Well, good evening, everyone. My name is Heather Brown, the Strategic Partnership Officer for Truman VA. Thank you so much for joining our live interactive telephone town hall. This town hall for veterans gives you the opportunity to speak directly with us. You'll hear a brief welcome and introduction from the new Columbia Facility Director, Mr. Christopher Meinhaber, and then we'll have a brief program overview on PACT and Dole Act, Fisher House updates, and facility construction updates from other members of our leadership team. We've scheduled this Tele-Town hall for 60 minutes, during which time we'll be asking a series of poll questions, and then we'll share the poll question results during the town hall. As this is an interactive forum, we would love to hear from you. So we'll be taking as many questions from participants as we possibly can on this event. So if you have a question, you can press *3 on your phone keypad at any time, and you'll be placed in line to speak with a member of the staff. They'll take down your name, where you're calling from, and your question, and then we're going to do our best to answer as many of those questions as we possibly can this evening. Remember, if you have any questions throughout the event, please press *3 on your keypad. All right, everyone. We're going to ask a really quick poll question, and you can vote by pressing the corresponding number on your keypad, and then we'll share the results momentarily. We want to know how you've heard about the PACT Act. Press 1 for radio, press 2 for mail,
My name is Donna,
press
and I'm
3
here to collect
for email. Oh, Donna, I don't think that you're on the right one. Oops, sorry about that. Okay, let's try that again. So press 1 for radio, 2 for mail, 3 for email, press 4 for a VSO or another veterans organization, or press 5 if you've never heard about it. Remember, we'll share these momentarily. Now I'd like to welcome and introduce Mr. Christopher Meinhaber, Director of Truman VA. Mr. Meinhaber?
Well, good evening, and I really am amazed at the showing of support and the number of folks we have dialed in this evening. I'm Chris Meinhaber. I'm the new Medical Center Director here based at the Columbia VA Medical Center at Harry S. Truman. Super excited to be here. A little bit about myself. I've been in VA for nearly 20 years, most recently coming from the Houston, Texas VA Medical Center, or the Michael E. DeBakey VA Medical Center, where I had the honor of serving as the Associate Director or Chief Operating Officer for one of the largest, most complex VA medical centers in the country. Super excited to be here in Columbia. Have been in here for nearly 90 days and have really been impressed with the high quality of care that we provide to our veterans and the great staff that we have here. So really looking forward to the questions tonight and really interacting with our veterans that we have the honor to serve. So that's all I have. Heather, I'll turn it back over to you.
Well, thank you so much, Mr. Meinhaber. Okay, so that was fantastic and very quick. Did you also want to talk a little bit, Mr. Meinhaber, about the updated masking policy?
Sure, great feedback there, Heather. Yeah, so recently, within the last couple of weeks, we have changed our masking policy to where it is optional for you to wear a face mask, but also do request that you provide respect to those veterans and our staff who choose to continue to wear a face mask because of the COVID pandemic. And now that we've moved into more of an endemic phase, we are certainly happy to see everybody's smiling faces at all of our at our main hospital and all of our outpatient clinics. But do ask that you provide respect to those folks who do continue to want to wear a mask, and folks who do ask you to wear a mask, if you're around them, please be respectful as well. So, but masking is optional across all of our sites of care here in Central Missouri, and really excited to see everybody's faces again. Thanks, Heather.
All right, well, thank you for that. Well, we have the results of our very first poll. So it looks like about 9% of you heard this from a radio, 8% got it in the mail, 15% from email, 18% of you received it from a VSO or another veterans organization, and about 50% of you have never heard of PACT Act. So I'm really excited to be able to talk about that later tonight. But before we do, it's now time for our second poll question. So this time, we really want to know how you want to be updated on Truman VA news and events. So if you can, press 1 for email, press 2 for social media, press 3 for the website, press 4 for U.S. mail, or press 5 for all of the above. So our next topic on the agenda is about PACT Act and the new Dole Act. So I actually get the pleasure of introducing that to you today. So the Honoring Our Promises to Address Comprehensive Toxic or PACT Act of 2022 is a newish program that was really put into effect this past October. What it does is it expands and extends eligibility for VA healthcare for veterans with toxic exposures and veterans of the Vietnam, Gulf War, and post 9/11 eras. It adds about 20 more presumptive conditions for burn pits, Agent Orange, and other toxic exposures. And it adds more presumptive exposure locations for Agent Orange and radiation locations. It does also require the VA to provide a toxic exposure screening to every veteran who enrolls in VA healthcare. And of course, it always helps us improve our research, our staff education, and then treatment related to toxic exposures. So in the past, veterans during Vietnam, if you were boots on ground in Vietnam or in the brown or blue waters, you met the criteria for Agent Orange exposure. However, they've now expanded that. So if you served in Thailand or at any U.S. or Royal Thai base between 1962 and 1976, or Laos between December of 1965 and September of 1969, or certain provinces in Cambodia from basically April 16th to the 30th of 1969, or Guam from January 9th, 1962 to July 31st of 1980, you would also qualify for Agent Orange exposure. It also expanded eligibility for those who served on Johnson Atoll or any of the ships that called there between January of 1972 and September of 1977. And that was the area where they were dealing with atomic testing. So the two new presumptive conditions, the biggest one most of our veterans will see is high blood pressure, or also called hypertension. And of course, a presumptive condition means that it is something, if you were in those locations that I just mentioned and you have hypertension, it is presumed that that was caused by that time in service. We really encourage you to talk to a service organization like the DAV, DFW, Missouri Veterans Commission, so on and so forth, to go ahead and get set up for that. The second one is called MGUS. It's a monoclonal gammopathy of undetermined significance. So if you have any of those presumptive conditions, we definitely encourage you to go and talk to that. The PACT Act also expanded Gulf War for our Gulf War veterans. If you served on active duty in a theater of combat operations after the Persian Gulf War, you also may be eligible for VA healthcare. And then, of course, it extended the eligibility for certain combat veterans. So prior to this, if you served before 2013 and you served overseas, you had 5 years to get into the VA healthcare system where your income didn't preclude you from VA healthcare. What happened, though, is they gave us 1 more year for those who served in a theater of combat prior to 2013 and had not previously enrolled in VA healthcare. It gave us a year to get them in the system. So if you find yourself in that particular instance, we encourage you to contact the VA. That phone number is 573-814-6535. And that's our enrollment and eligibility. And that way you can go ahead and get scheduled for VA healthcare. This extended enrollment is, like I said, for those who served prior to 2013 is only good for this year. So basically we have until September 30th of this year to get everybody logged in or enrolled in VA healthcare. So if you know of a veteran who hasn't enrolled, we are definitely encouraging you for that. What it did for those who were discharged after 2013 is it extended it to 10 years, which is great. So that gives us a lot more time to get those veterans enrolled in VA healthcare. There are some additional service-connected illnesses, and I'm just going to go through a few because there are quite a few on here. There are a number of different types of cancers on here, like neck, pancreatic, reproductive, head, and lymphoma. So again, not all-encompassing, but quite a bit. The big ones we've noticed are chronic rhinitis and chronic stenitis. If you have chronic bronchiolitis or emphysema, if you've got COPD or chronic obstructive pulmonary disease or chronic bronchitis, then that is something that is also considered a presumptive condition for our veterans who are post 9/11. Now, our toxic exposure screening, they take about 10 minutes, between 5 and 10 minutes, and if you screen positive about that, toxic exposure to things like burn pits, Agent Orange radiation, contaminated water, and other exposures, then we're going to sit down with you and do just a little bit more. However, the toxic exposure screenings are not going to do anything initially for you. This is not a service connection piece. It is not a diagnosis piece. This really is for us to gather questions for that, questions so we can figure things out further from that. And then, of course, there is a second PACT Act that actually has nothing to do with the original PACT Act, but this is the Native American Veteran Parity and Access to Care Act. And what that does is for eligible VA veterans, so you have to already be in and eligible for VA healthcare, but eliminates the co-payments for Native American, Native, and Native Alaskan veterans accessing healthcare. So again, to qualify, you have to be eligible, you must be enrolled for VA healthcare, and you have to fill out an attestation form stating that you're Native American, Native Alaskan with a copy of your tribal card or an affidavit. So if you're interested in that, you definitely need to contact our eligibility department. Again, that number is 573-814-6535. All right. And then the Dole Act was relatively new. This just came out, I believe, in March. And what this did, March 31st of this year, this expanded eligibility for VA hospital care, medical services, and nursing home care to our World War II veterans. So in order to qualify, a veteran must have served during World War II from December 7th, 1941 through December 31st of 1946. And basically what this means is their income will no longer be a detriment to their VA healthcare eligibility. So if you know of someone who meets this qualification, please make sure that they are contacting us as soon as possible so we can get their healthcare started. All right. So with that, that is my presentation on PACT Act. So let's go through our results of the last poll. So remember the question was, how did you want to hear from us? And it looks like a resounding number of you want all of the above. You want email, social media, website, U.S. mail. But the other big one is 38% of you wanted email, 4% wanted social media, 2% wanted the website, 14% U.S. mail, and then 42% for all of the above. So thank you so much for presenting in that poll. So remember, if you have a question you'd like answered, please press *3 on your keypad. And now I would like to introduce Mr. Terry Woodcock, Fisher House Manager at Truman VA. Terry, are you on?
I certainly am. Good evening. It's a great opportunity and privilege to speak to all these veterans out here about our newest addition to the Truman VA family, which is our Mid-Missouri Fisher House. And if you have not heard, the Fisher House is going to be having our ribbon cutting grand opening ceremony on the 14th of July at 10 a.m. And we'd love to see as many of our veterans there as possible. So if you are not aware of what a Fisher House is, a Fisher House is a temporary accommodation for at no cost for the families and the caregivers of hospitalized veterans and service members. And the veterans and the service members may receive accommodations in the VA Fisher House during an outpatient episode of care if they're accompanied by a family member or caregiver and are medically stable. And we have some criteria that you must meet before you or your family members can reside in the Fisher House. One is that the veteran must be receiving qualifying care through the VA. All of our guests are required to be independent, be able to carry out their daily activities on their own, unassisted, and they must travel at least 2 hours from the Truman VA or live at least 50 miles away to be eligible to stay at the Fisher House. Veterans are not usually able to stay at the Fisher House by themselves. They must have a family member or caregiver for the duration of their stay. Let me see, I want to hit a few more high points here. The process for receiving accommodations here is going to require a consult through your provider. And once the provider, your social worker, determines that that assistance is needed, they will submit that paperwork to us. We'll evaluate based on space and accommodations and make a determination whether or not we can accommodate the veteran's family or associates that are providing that care. So in a nutshell, that is what the Fisher House is. And please take every opportunity to inquire with us. If you need further information about it, whether or not you'll be eligible to stay, and we'll be happy to engage you with those questions.
All right. Well, thank you so much, Terry. We appreciate that. All right. So it looks like we've got our last poll question. So what topics do you want us to cover for our next town hall? If you could press 1 for diversity in the VA, press 2 for whole health classes and offerings, press 3 for weight loss and what the VA offers, press 4 for how billing and insurance works at the VA, or press 5 for dental eligibility through the VA. And then, of course, we're going to share those results momentarily. I'd like to now welcome and introduce our last speaker, Andrew Wiggins, Assistant Director at Truman VA. And Andrew is going to be talking to us about construction updates for the facility. Andrew, are you on? I am. Thanks, Heather. So Terry has already touched base on our new Fisher House. This 16-suite house is going to be located on the northeast corner of our campus. We're going to be hosting a ribbon cutting and a dedication ceremony on Friday, the 14th of July at 10 a.m. And we do expect to start seeing guests that first week in August. I wanted to also touch on 5 other capital projects. The first being a new community-based clinic located right here in Columbia. We're going to be opening a clinic on the Buttonwood Drive on the south side of Columbia. This clinic is going to provide primary care, behavioral health, and lab services, and we expect it to be opening in September of 2023. Our Renovate Behavioral Health Clinic, we spoke about this on the last town hall. It's a 3-phase project. The first phase is completed, locating pain and physical medicine and rehab up to the 4th floor. The second phase was completed in April, and we opened a new behavioral health check-in along with some group rooms. And the third phase is still in progress, and it's going to construct new provider offices and treatment rooms, and we're expecting completion of this project in late fall of 2023. The next project I'd like to highlight is our hematology and oncology clinic, as well as inpatient pharmacy. Our new hematology oncology clinic will be located on the 3rd floor of our ambulatory care addition, which is on the north side of our campus and is scheduled to open on July 17th. This new space will include 14 infusion bays, and as part of this project, we're constructing new compounding space for our inpatient pharmacy. The next project I'd like to highlight is relocating our medical ward for patient privacy. This project is going to construct 24 new private inpatient medical rooms along with a new outpatient dialysis space, inpatient dialysis space, and all the associated support spaces. This will be located on our current this will be relocating our current medical ward floor from the 4th floor to our 3rd floor. And it's really a key component in our facility master plan to really co-locate all the inpatient beds to the 3rd floor. The expected completion of this project is the fall of 2023. Last but not least, I just wanted to touch on Rolla. We're excited to be expanding our services in the southern catchment area along the I-44 corridor. With the approval of the PACT Act, we were able to proceed with the acquisition of a major lease in the Rolla delineated area. This lease is the first of its kind for Truman VA, and major leases such as this are a multi-year process. We're currently working with the National Office for Construction and Facilities Management, and we're still awaiting award of this contract on the lease. Once the contract has been awarded, we will be able to share more details regarding the exact location of this clinic. And that's all the updates I have for today, Heather. Thank you so much, Andrea, for those construction updates. All right, so let's go ahead and go to our questions. So reminder, if you have a question, please press *3 on your keypad at any time to get into the queue to ask a question. And our staff will write down your questions and we'll answer it on the call. So we have a question here. It looks like about some weight gain and fighting for the disability related to that. It looks like there have been promises of some plastic surgery to remove the skin. Dr. Zare, can you talk a little bit about what we can do as far as surgery for weight loss and skin removal? Sure. Well, currently, we can pay for surgery for weight loss. So we can pay for bariatric surgery, and hopefully, within the next year or two, we will have bariatric surgery available at our VA. We already have the surgeon, and we're just working on getting the approvals in place. And then, as far as the skin goes, unfortunately, the skin problem is considered cosmetic most of the time, and we cannot pay for cosmetic procedures. However, if there are some medical issues that come along with that skin, like recurrent infections, things like that, we do have a plastic surgeon on staff, and we can either have that surgery done at the VA or we can pay for it outside the VA. The other question in there was about transgender surgery, gender affirming care. We do provide lots of forms of gender affirming care. We can provide medication. We can provide post-operative care, but currently we cannot provide or pay for surgery for gender affirming care. There are some rules that have been written at the national level, but they are still under review. All right, thank you so much. We're going to actually bring you right back, Dr. Zare. So this veteran wants to know why they can only see their doctor every 6 weeks for pain management. They're wondering, are they only in the office every 6 weeks, or and then also looks like he has a primary care as an intern and that they've been switching things out. Can you just talk a little bit about our staffing and what exactly is managed in pain management? Sure. Well, 6 weeks seems pretty frequent, actually. A lot of times our appointments are spaced out more than that. Some primary care docs at the VA or within the community, they see their patients once a year or every 6 months. Sometimes doctors see their patients every 3 months, depending what's going on. So it's really based on what's happening with that patient. For pain management, I don't know that anybody's being seen that often unless there's some type of an active treatment procedure, like a protocol going on. Otherwise, it's generally spaced out quite a bit more than that. 6 weeks is pretty quick. In medicine, sometimes you don't even have, that's not even enough time to know if something's going to be effective. And I was looking for the next part of that question because I forgot it and I don't see it in here anymore. Heather, what was the next part of that question? It was about
yeah,
pain management.
Sometimes there are some. Oh, the intern. That's right. So the intern, we are a teaching facility. Many VAs are, I would say most, and we do have interns and residents in our primary care clinics, actually probably in all of our clinics. If you are assigned to a resident or an intern in primary care, you have an attending physician as well. And if you need to talk to the attending at any time, then you can do that. You can just ask the nurse to talk to the attending, and you can do that. They're always in clinic with the resident, and they see all of the telephone calls and requests as well.
All right, fantastic. Thank you so much.
Thanks,
So
Heather.
the next question we're going to have Mark Goldsmith. He is our beneficiary travel guru, and he's going to answer, it looks like there are a couple questions about beneficiary travel on why there's no more kiosks and how convenient that was, and how much harder it is now for them to get paid mileage. Can you talk about why they did that, why they took away the kiosk, and what the process is?
Thank you, Heather, for that. It's a great opportunity to speak this evening. The kiosks, first of all, I'll handle the kiosks. The kiosks were removed because they did not communicate with the new beneficiary travel self-service system. The self-service system is a system that has been in place nationally so that anyone can sit there and put in beneficiary travel pay electronically by using either their tablet or utilizing their smartphone if they have one, or a computer at home. We know that brings up a lot of inconvenience, especially for our senior veterans that we have, and it's difficult for them to sit there and enter their travel pay request. So that's why we have members of our staff out there with tablets assisting people and helping them file their travel pay. Yes, it is a cumbersome system. We're still working the bugs out of this system. It's getting better, and once we get it fully into uh, position, you should see a quick turnaround in your travel pay. Instead of being 4 to 10 days, you should see it within 2 to 3 days. And that's what our goal is. That's what we're working on. And if you have any questions about it or any concerns when you're in here at the hospital, just talk to me, and I'll take time out of my schedule to sit down and talk with you about it.
All right, thank you so much. The next one is Dr. Zare again. We are going to talk a little bit about prescription medications. So it looks like a couple of our veterans are having issues with prescription medications through community care, getting them filled. And then the other one is why can some of the medications have to be renewed monthly versus being able to do it online versus getting a 3-month supply? Dr. Zare, do you want to take that on?
Sure. So we currently, for the 30-day supply, there are 2 reasons for that. One is either that it's a non-formulary medication and it's super expensive, so the VA only gives out 30 days at a time, because if we give out 90 days and then the veteran only takes it for 10 days, then we've spent, $1,000 more on meds that the veteran isn't going to take. So they send out 30-day supply on those non-formulary medications. The other reason is drug shortages. We've been hit with a lot of drug shortages over the last 3 to 4 years. So sometimes something will happen, like a medication manufacturing facility will go offline for some reason. They've had sterility issues, or they had a fire. I mean, there's so many different reasons that we've seen over the past few years that will be in short supply of some like normal medication, like a regular thing. So what the VA will do is they will move everybody to 30-day supply so that everybody has some. And then once the supply gets better, they can switch everybody back to a 90-day supply. What I would encourage you to do, because that switch back is not automatic, when you go to see your doctor the next time, just make sure that they try to switch it back to 90 days. And if the supply is there, then pharmacy will be able to get you back to a 90-day supply. For community care prescription, we currently have a full-time pharmacist who works on that, and we're adding another one. Part of the problem happens when the community care physician that you're seeing doesn't know the process. And we send them a big packet of material, but I know from working in a clinic, sometimes it's hard to read through like a big packet of material. So sometimes they don't know the process. So if that's the case, their office can call our community care department and talk to them, and they can learn the process for sending us the prescription, and then we get it filled. So in that way, if they're an Optum provider, it actually just goes through our pharmacy, and it's really a prescription from your physician, the one you're seeing in the community. Previously, we had to take all those prescriptions through our own primary care department, but we don't have to do that anymore. So We just need to make sure that our community care department communicates well with the community care physician, and then we can get that done a lot more easily for you.
Thank you so much. All right, so it looks like there are a couple questions that I should be able to answer right now. So these are actually about the anthrax vaccine that a lot of our post 9/11 veterans received, and does that qualify under the new PACT Act? So right now, there's nothing specific for anthrax vaccine. However, our toxic exposures could include things like that. So if you have not received your toxic exposure screening, which remember, it does not do anything for you. The screening itself is just collecting data on our part. But what it will do is gather that information, and if we can find enough of our veterans have that same kind of issue, then it will definitely help other veterans add that presumptive condition list. So, and it looks like Dr. Zare can speak a little bit on the anthrax about that as well.
Yes, there was a question about anthrax long-term effects. Currently, there's not research that proves at least that there are any long-term health effects from the anthrax vaccine. I know that there are a lot of people who've had the anthrax vaccine who would say otherwise. Currently, we just don't have research that proves that. So therefore, we don't see things like an automatic service connection or diseases that are connected with anthrax vaccine. Thanks, Heather.
All right, thanks, Dr. Zare. All right, so there seem to be a couple questions again about the PACT Act and the exposure to toxic burn pits and things like that. So I'm going to give a real quick brief lesson in VA healthcare. So the VA is actually made up of 3 separate entities. There's the department underneath the umbrella of Department of Veterans Affairs. So the first is the Veterans Benefits Administration. And when you think about that, think about things like your education, your home loan, the service connection piece. So kind of think the money side is the benefit side. And then you have the healthcare side. And that's what we strictly do. So our job is to take care of your healthcare. This gets very confusing for a lot of veterans because they may have been diagnosed with something, from a burn pit or a toxic exposure, but has never been seen at the VA hospital. They can still apply for a service connection for that without being seen at the VA hospital. However, we encourage all veterans who fit that mold to come and be seen at the VA, as that definitely does help provide easier records for when the benefit administration is looking at your service connections. In order to get service connected, you typically need to go through somebody like the DAV, VFW, American Legion. You can do it by yourself online. However, we do encourage you to talk to someone who has the knowledge behind that, so that way you're not going to have to miss out on an opportunity. If you don't check the right box, it might get returned to you. And so when anytime that you're talking about this, not getting, should I bring the VA my diagnosis, you definitely want to come and talk to us if you've not already been seen by VA healthcare, especially right now. If you were deployed, in that 2013, we definitely want you to come in and utilize the VA healthcare system. And then if you have not been seen, please call 573-814-6535. That is the number to our enrollment and eligibility office, and they can help you with that as well. There was another question on modeling of exposure plumes in Desert Storm, where they were stationed between the DoD and VA. There is not that I know of at this point, but again, it's important for you to come in and get that toxic exposure screening so we can find some more presumptive conditions. So if you have not filed, please make sure that you do file for that. And there is another question on if you file for the claim for PACT Act, it may take away your percentage coverage qualifications with other claims and conditions. And I could say it might be true, it might not be true. If you are at 100% service connected, you may not need to put in unless you believe that it is something that you will either die from or you will be further along affected from it. But if you are not along that line, I definitely would go ahead and apply for that. So the next one, Dr. Zare, for you, you are just a very popular person tonight. Can you talk a little bit about chiropractic care through the VA and how to get an evaluation for that?
Sure. Currently, we provide chiropractic care in the community. We don't have a chiropractor at our VA, so we do provide it in the community. Now, we do have some guardrails on that. We follow the major insurance companies on what we will approve. So it's a certain number of visits over a certain period of time. And what we don't provide is like chronic ongoing chiropractic care for years and years and years. So if you think that you are in need of chiropractic care, I would talk to your primary care physician and ask about that. Hopefully, eventually, we'll have a chiropractor at our VA. We're just working on space.
Okay. All right. So the next one is actually for Steve Richardson. He is our Chief of Health Eligibility. Steve, are you on the phone?
I am.
All right. So we have a question about receiving VA treatment when traveling. Can you talk a little bit about that?
Sure. All eligible veterans are capable of receiving care at any of our Veterans Health Administration facilities, both domestic and abroad, where there is facilities, and there are also the exact term escapes me, but there's a program for receiving care and having your care monitored and so forth when you're traveling overseas. The phone number Heather gave you earlier a couple times for the health benefits advisors, they can give you the details and share additional information on that. If it's more of a commonplace thing, if it's the proverbial snowbirds who spend some time in the South in the winter and come back to their respective homes up north, we have a traveling coordinator there at the VA hospital here in Columbia. And again, contacting your primary care provider, they can have that information available for you. You can contact our telephone operators. They can also forward you that information. That covered the question, hopefully.
Yeah.
Okay.
Thank you so much. So yeah, there's the traveling veteran program. They just need to contact their social worker closest to their PACT team. They can work on that. And then there's also the foreign medical program that you talked about for service-connected conditions outside of the country. So thank you, Steve. The next question is, can you talk, Dr. Zare, I'm sorry, I'm going to go back to you. Can you talk a little bit more on expanding services like MRIs at the other outpatient clinics? Is there anything in the works for that?
Sure. So first of all, we are going to be opening our Raleigh clinic probably within the next year or 18 months. Construction has not started yet, but that is coming. That will be a large clinic. We will have some specialties there. We will for sure have podiatry, optometry, dental, and physical therapy. And then hopefully, if we can hire them, we'll have some medical specialists, things like oncologists, cardiologists, pulmonologists, endocrinologists. Really, whatever we can hire in the Raleigh area, we're willing to hire. It's not an easy place for us to hire physicians. The CBOCs, all of our community clinics, those are tough sells right now to hire physicians in. The number of primary care physicians in the country has really declined. And so it's kind of a race and it's a competition to hire primary care physicians. We are short-staffed at a few of our clinics, getting better. Most of our docs stuck with us through the pandemic, which was really nice. And so since the pandemic has abated some, we've had some retirements. We're happy they stuck through it and extended their retirement for us, but now they've retired. So we are hiring physicians at several of our clinics, especially in Columbia. We're a little bit short in Columbia, but we're getting through it. If you know of any primary care physicians or nurse practitioners that would like to work for the VA, we're a great VA to work for. As far as other services at the clinic, we currently have podiatry in several of our community-based clinics and physical therapy, and we have optometry at Marshfield and Jeff City. So we would love to have podiatry, physical therapy, and optometry at all of our community-based clinics. And as those leases come up for renewal and we're able to add space, we do add things. So currently we're working on some additions in Marshfield for the next lease there. I'm hopeful to get a bigger audiology clinic there and physical therapy. So those are the things you should be seeing. Other than that, we will also be increasing our numbers of telehealth services in those clinics. You can access telehealth either in the community-based clinic where you sit in front of a monitor and you see the doctor who's in Columbia, or you can be at home and do this by video conferencing on your own device. So we're trying to increase the ability for people to be seen in those areas as well.
And Dr. Sarah, as a follow-up to one of those
And then
questions,
I would say one more thing. Raul, yeah, go ahead.
No, it's okay. Go ahead.
Go ahead, Heather.
So the question was
Raul will have a CAT scan, and Raul will have CT scan as well as plain film X-ray, and then we will probably not have MRI there. We will have mammogram available in the Columbia VA anytime. We're just waiting for a few things from the vendor, and so we will be able to do mammograms at the Columbia VA. What else, Heather?
That was perfect. I was going to ask you about mammography, so thank you. I do appreciate that. The next question is actually for Mark Goldsmith. Mark is, again, our chief over beneficiary travel. Mark, in an emergent situation, after transportation, can you tell us why some veterans get a bill for that?
Okay, as I'm reading the question that was asked, the question was they refused transit support after EMT treatment and then got a bill and they were wondering why. And it really boils down to the fact that the veteran did not travel. It's just that simple. In order to be eligible for travel pay or beneficiary travel to cover the bill, you have to travel. And if they just show up and treat you and then leave, then you didn't travel anywhere, so there's nothing for us to pay.
Okay, thank you so much. So Terry, this is going to actually be for you regarding the Fisher House. Can you talk a little bit, now it says give a list of presumptive conditions. Can you talk a little bit about where they can find copies of the rules and regulations for who can stay? Do you know where they're going to be located?
Well, if I can provide a little bit of clarification on what I think the question is. So there's some confusion about who's actually staying in the Fisher House. So the Fisher House, as I mentioned, is provided for the families or individuals supporting a veteran who's receiving care, and in some instances, the veterans themselves. But as far as a specific list of presumptive diagnoses that would allow a veteran to stay, that patient would primarily need to speak with their provider or their social worker if they suspect that their stay is going to be over several days or several weeks, depending on the nature of their treatment. And then the provider would then submit a consult to us, and then we would evaluate whether or not we have the space or the accommodations for the time that they're going to be receiving their care here. So two things. One, the family members are the ones primarily staying at the Fisher House, and in the event that the veteran is the one being accompanied with family members to stay in the Fisher House, that will be discussed with their provider, and then the consult sent over to the Fisher House to see if we can accommodate them during that period of time. And I hope that clarifies the question that the veteran asked.
Thank you, Terry. All right, looks like we have a few questions about dental eligibility. So I'm going to talk very briefly about that. Eligibility for dental is a very difficult thing for most veterans to receive. In order to qualify, you have to be 100% service connected, permanent and total. So that means that your service connection is not going to change. There are a few other ones to do it. So if you have recently discharged from the military within 180 days, you need to contact the VA and let us know that you would like your one-time dental treatment program, and we can go ahead and get you set up for an exam. That exam will then take it all the way through until that issue or issues that first exam found is complete. After that, the VA is said, you're good, your teeth are great, good luck, and that's it. We usually won't touch it after that. There are a few other instances. If you are in a VA-sponsored rehab program for more than 60 days, you would also qualify for VA to do dental care. And then if you are in the Chapter 31 Voc rehab program through the VA, you are also eligible for dental care. And what that means is we really just want to make sure that your teeth are taken care of to the point where you can become eligible, or I'm not eligible, where you can be employable. And so we're not talking, veneers or anything like that. So unfortunately, the dental care through VA is very limited. And so if you do have questions, you can always call the Enrollment and Eligibility Office at 573-814-6535 if you have questions about dental eligibility or you have questions about VA healthcare eligibility. It looks like we have a question about sleep apnea. Dr. Zer, can you talk a little bit about about sleep apnea and what the VA is doing to help our veterans right now?
Sure. Well, we have noticed that a lot of our veterans have sleep apnea. We have a lot of veterans that are service connected for sleep apnea. We do have we actually have two sleep specialists at our VA, Dr. Boyle and Dr. Johnson. We have a sleep clinic and we have a full service sleep lab. We are adding some new things. One of the new implantable devices, we can do that now as well. So we have really anything that you would need for sleep apnea. So if there are any questions about that, just ask your primary care provider and they can get you to the sleep clinic.
Thank you so much for that. It looks like we have a positive feedback, so let's just talk about that one real quick. It looks like this person says, outstanding. The service from the Truman Hospital has been at all levels. Can't say enough about the Truman Clinic and Hospital. Very thankful for the whole staff. So thank you so much for letting us know that. There is also a question about VA massage therapy, Dr. Zer. Would you want to talk a little bit about, actually let's combine this. Can you talk a little bit about VA massage therapy? And then also, if the VA is doing any research on the use of legalized marijuana?
That's a good one. I like that one. That's a fun question. So massage therapy is now part of our whole health offerings of care, and we do offer massage therapy in the community if it meets certain criteria. So you can ask your provider about that as well. And then as far as marijuana goes, unfortunately, marijuana is still federally illegal. So there is some research going on, I believe, in different areas, but as far as the VA goes, no, we're not doing any research on that. But I will tell you that we are offering some interesting medications for depression. The one that has a ton of promise is called S-ketamine. You've probably heard of ketamine before. It's used as an anesthetic agent. It's also abused quite a bit. It's a club drug, so to speak. But we use a version called S-ketamine at RVA, which is a nasal spray, and it's for patients who have very severe chronic depression, and we have seen it work wonders. We do that. We also have something called transcranial magnetic stimulation, which has also helped people out quite a bit with severe depression. So RVA is very innovative, and we're trying to do everything that we can to help our veterans who have mental health conditions when the traditional treatments have failed. Sometimes I think eventually some of these new treatments will become the traditional treatments, and we won't have to go through all of the drugs to try all the regular drugs first to get to those. What was your other question, Heather? I think that took care of that. There was something else in here about medications, so if I could just talk about that.
Yes,
Someone
yes. Please do. And
really
the question is about
their primary care physician. Sure. Right. So their primary care physician took a new job and the patient is on Dole Act. Yes. Dole Act is actually a very common medication that we use. It works really well for several conditions. And so your new primary care provider should continue to provide that, and you should not need a referral for that. And there was a question about Ativan and someone who had moved. Some VAs have really worked hard to reduce the use of certain controlled substances, and that's really a push from the CDC and also from the VA. So if you feel like you're not being treated fully for your condition, just please reach out to your primary care provider and talk to them about that. That's probably something that I would have sent to mental health or behavioral health for consult. Thanks, Heather.
Thank you so much. It looks like we'll be able to answer a few more questions before the end of our call. Let's see. Regarding disease post-services, could you go through which diseases have been caused by the anthrax vaccine? And I think you already answered that one. I apologize. All right. On pain management, Dr. Zare, I'm sorry to keep bothering you about this, but you are the one with all the information. Can you talk a little bit about when the doctor in pain management states that there's nothing that they can do? Can you talk a little bit about what are some of the other maybe alternative options for our veterans dealing with pain?
Sure. There are some pain conditions that we can't fix in medicine, not just with the VA, but everywhere. There are certain things that just cannot be completely fixed. We can help to make things more tolerable. What our goal is in those situations is to help you to live, what's the word I'm looking for here? Help you to live a life that is good for you, that is a happy life and that is a comfortable life. We may not get rid of all the pain. So we do have other things available. One of the great things that we have at our VA now is something called the Performance Program. And it looks at all aspects of your pain, and it looks at ways that you can help control your pain with the way that you live, looking at nutrition, movement, and exercise, and your mental health. So if you're interested in the Performance Program, I think it's a wonderful thing. We've had some really great outcomes with that. Just ask pain management or ask your primary care doc about the Performance Program, and they can put a consult in. If you don't want to do the full Performance Program, you can definitely take advantage of the pieces of it, like the pain psychologist or the pain pharmacist. Several different people within that group offer solo consultations if you would like it.
All right, and then the last one I'm going to do for you, Dr. Zare, I promise for tonight. Can you talk a little bit about community care and prescription medications? It looks like sometimes there may be a disconnect with veterans who go out for community care and getting prescription medications from that provider. Can you talk about that process?
Right. I talked a little bit about that earlier. What should happen is that the physician that you're sent to from the VA, so it's a VA care in the community, they should get information on how to send prescriptions to us so that we can get your medication sent out to you. So then when you get the medication, it actually just comes from the VA like it normally would, but it will have that community care physician's name on it. This is a huge improvement over the way that it used to be several years ago. Sometimes that community care doctor's office doesn't know the process because we have a lot of new docs who have opted in for the Optum program. If they don't know it, we need to know it so we can re-educate their office. So if you're having problems with that, please call our community care department. And if you call the VA, then you can hit the buttons to get to our community care department and let them know that you're having trouble with your medication. We can provide more education for that office so that they can get the prescriptions to us efficiently and we can get the medication out to you quickly.
All right. Well, thank you so much for that, Dr. Zare. We are actually out of time as far as answering the questions, but don't worry. If you have called in and we have screened you for a question, we will be reaching out to you later in the next couple weeks so we can chat with you one-on-one about that. So let's go ahead and talk about our last poll that we had done. The question was, what did you all want us to cover for our next town hall? It looks like 7% of you wanted to learn more about diversity in the VA. 11% of you wanted to know more about whole health classes and offerings. It looks like 29% wanted to know more about weight loss and weight loss offerings, and then 12% on how billing and insurance works at the VA, and a overwhelming majority at 41% wanted more information about dental eligibility. All right. Well, that was very interesting, and I appreciate everybody for talking about that. We'd like to thank you for taking the time to join us for our facility-wide Tele-Town Hall, and we really appreciate the opportunity to speak with you and answer your questions. Again, if we didn't get to your questions, don't worry. We're going to be contacting you in the next week or two to discuss your questions or issues. We are looking forward to hosting more of these events in the future to keep you informed on what we're working on and other important updates. Thank you again, and have a wonderful evening.